September is Peripheral Artery Disease Awareness Month, a time to shine a light on a condition that affects 1 in 5 adults over the age of 60, and many without them even knowing it. And today, we're joined by two specialists, Dr. Mark Jenkins, an interventional cardiologist, and Dr. Dan Jones, a podiatrist, to help us understand the warning signs, the risk, and the simple steps that we can take so we can save some limbs and some lives this morning. How are you guys?
Good morning. Good morning.
Glad to have you guys here. So, Dr. Jenkins, I want to start with you. What exactly is peripheral artery disease, and why is it such a serious health concern?
So first of all, thank you for having us, Aaron, and thank you for shining a light on this very common problem that affects probably over 12 million people in the United States, over 200 million people in the world.
Wow.
And it's a disease process of the circulatory system that affects the blood vessels. It's like coronary artery disease, but like heart disease of the legs.
Interesting.
And where the arteries become blocked or clogged with fatty material and cholesterol material, and blood flow can't get to the legs. And therefore people have problems like pain, and actually could lead to amputation or losing the leg as a result of the decreased blood flow.
Well, we don't even want to get that far. So tell me, you often see PAD, like you said, in the lower half of the body, right? So the feet and the legs. But what are some of those early warning signs that people can look out for that are of significance, that really mean something, and maybe we should be taking a harder look at, maybe calling someone or getting some help?
So awareness is number one, and you're right. Over, as I told you, 12 million people have it, but 50% don't know. So signs like pain in the legs, or walking and having pain or tightness in the leg, or sometimes you can feel your foot and it feels cool, or you look at your shin and you don't see hair growing on the shin.
Really?
But simple things like pain and walking. Sometimes it's not a cramp and you don't need a banana. You probably need to see a cardiologist or a vascular specialist.
Wow, wow. Dr. Jones, any input on this one?
Well, just as Dr. Jenkins said, when patients come to see the podiatrist, oftentimes they present with leg pain, cramping in their legs and feet, discoloration, increase in darkness just because of poor blood flow. Many times they may complain that one foot's colder than the other. Many times they're complaining of numbness or weakness in the limbs and legs, and so that causes us to think about peripheral arterial disease.
Wow, wow. Okay, so these are things, right, that could be naturally happening, and like you said, it's just something we don't even pay attention to. We're like, oh, okay, our feet are cold today, you know, like you're not thinking any farther into it. What is the correlation of PAD to cardiovascular complications and even severe life-threatening problems later on down the line?
So it's not a simple problem of the legs. PAD is a systemic problem. In fact, if you got PAD, you're probably 50% likely to have heart disease.
Wow.
And probably 2 times more likely to have a heart attack or stroke or die from cardiovascular disease. Actually, after you get your leg amputated, you're 50% likely to die from heart disease in 1 year after an amputation. So it's closely linked. Like I said, it is the heart disease of the foot, and usually it picks up in the foot. The problem is, if you're black and look like one of us, you're 2 times more likely to have it and 4 times more likely to have an amputation. Just in Texas, in Dallas, by zip code, if you live in North Dallas versus South Dallas, you're 4 times more likely to have your leg amputated than get the treatments that we provide.
This is so interesting, and I'm glad you touched on ethnicities, because my fellow African Americans out there, we do not pay enough attention. I mean, it even runs in my family. Even my feet swell up, and I'm only 27, you know what I mean? And so paying attention to those things early is so incredibly important. What are some simple screening tests viewers can ask their doctor if they suspect that they have PAD, Dr. Jones?
Well, in our office, the arterial blood index, we will actually use a Doppler, an instrument, to measure the pulses in the legs and feet. And many times those numbers are very pathognomonic for peripheral arterial disease. One thing I did want to add is that many times patients have sores in their legs and feet that won't heal, and that's another prime indication of lack of blood flow getting down to the legs and feet.
I have learned so much this morning. My goodness, I mean, I want to take this information to my own family, you know what I mean? And I think that's kind of what we have to do, right? Is take the knowledge and be able to spread it to others so that we know what to do in these situations, so we don't end up losing a limb and then maybe possibly our lives only a year later. Thank you so much for coming on here and sharing your knowledge with us, because this is incredibly important. We appreciate you.
Thanks for having us.
Thank you.